Okay, question 2 is from the Chamber leadership as well. We all know that most of you are supportive of the federal health care reform legislation. No one's calling it a perfect bill. As governor, what parts of the federal legislation would you want to see changed and why? Libby Mitchell.
The question is, what part would I want to see changed?
Yes.
First of all, I like much of it because we're going to, as a state, we were so advanced in making sure that people got coverage. We're going to get more partnership from the federal government because Maine is far along the line. I am concerned about, however, we're going to lose some of our monies for covering drugs for the elderly. That part I would like to have changed because we're going to get a smaller reimbursement for what we're spending on drugs for the elderly because it's going to go back to the federal government. I would like to have that stay in Maine. But I do applaud the parts that make sure that people aren't kicked off insurance when they get sick or that they're not denied insurance because they are sick. We've led the way in Maine, so I applaud their following our good examples. I wish they would honor our example about paying for drugs for the elderly.
Pat McGowan.
I can't think of anything that I would change immediately, but I would tell you that as the governor, we would set up our current systems, both in Maine Care and Dirigo Health, to dovetail into this federal system. I look at health care from a different perspective. Obviously, I was an employee of state government as conservation commissioner, but this, as a small business owner for 20 years, was the single most increasing amount of our bottom line every year was health insurance cost, more deductibles, less coverage, no portability, pre-existing condition bans. All of these things were a knife to the throat of small business, not just in the state of Maine, but nationally, as we watched this piece of our economy take these hits time and time again. I would make it fit. Many of the things we've done so far have put Maine ahead of most of the other states. And we look at this, and I know there's some cost issues with Dirigo, and Dirigo should be looked at again and possibly changed to fit into our economy. But the fact of the matter is, we were out in front. You never criticize or penalize somebody for trying to help on a cause that was so hopeless for so long, and that's health care for the people of Maine, the 130,000 people here, or the 50 million people nationally that are uninsured.
Rosa Scarcelli.
The first thing I would do is look at buying across state lines. It's something that didn't get passed, and it really should have, and I'm disappointed in that. We need to create market pools that are bigger. Dirigo Health will go, in my administration, in favor of the healthcare exchanges. We'll cover thousands and thousands more people in a far more efficient way. So those are a couple things that I will do, adapting to what was passed and also pushing to create pools outside the state of Maine. Why don't we look at partnering with New Hampshire and Vermont to create a bigger pool? And I will drive that process because we need to have competition in the state of Maine. I can tell you from firsthand experience in the last 10 years living in this market what it's done to me. My health care cost has gone up from 2005 to 2010, 14% a year. And the only way I've kept it at 14% is by reducing the coverage to my employees. Otherwise, I'd be facing a 30% annual increase, and that's impossible. My bottom line has not kept up. But a couple of things that we will do that are really important and will cover people that need access to general practitioners and preventative care, and that's adapting, using the past law and bringing into the state of Maine 133 qualified health care centers, just like Reverend Bob Carlson's Penobscot Health, which I talk about all the time because it is a bright spot in delivery of health care in the state of Maine. They deliver services to 45,000 people without regard to their ability to pay, and they do it at 8% overhead. And he is a model for how we should deliver services in rural Maine. And I will use that as a model for the 133 health centers.
Steve Rowe.
Thank you. As I said, healthcare, the cost of healthcare is holding back our economy. There's no question about that. And the federal legislation will certainly help. The last 2 days, I've talked to several small business owners, and I keep asking the question, if we could reduce your healthcare costs by 25%, what would you be able to do? I hear over and over, I'd be able to hire another employee. I'd be able to invest in capital equipment. Yesterday, someone said I would put an on-site daycare for my employees. This is why we're not growing. It's a high cost of health care and the high cost of energy. The federal legislation is good. There are many things that help Maine. Certainly the help with prescription drugs for seniors, the coverage of students. It's going to increase the age that students can be covered and stay on their parents' health insurance. The Medicaid reimbursement will go up for the state of Maine. There's some very positive things. But a couple of things I think probably could have been done differently. I did support the public option. It was not in the final bill. I think it should have been. So I'll put that out there. The other thing is the rebates, the drug rebates. Under the new bill, the drug rebates that are now going to the state of Maine will go to the federal government. And we've worked so hard for those. And so that's going to take us backwards a little there. But generally speaking, it's good legislation, and it will help us expand access to health care in the state of Maine.